Thanks very much indeed, Hannah. Yes, and you remembered it well. So thank you very much for that introduction.
With my
And
notes.
as you say, and I think probably the first thing really to say to everyone as we talk this evening is that, as you rightly say, it is Baby Loss Awareness Week. And I don't know who's tuning in either now or a little bit later on watching this on playback. So just to say, as we would to anyone in one of our training sessions or workshops, just to look after yourselves. And if that means through some of the subject matter that we go into, just need to take a little bit of a break and come back a bit later, that's fine. Or if you wanted to get in touch with SANS to speak to anyone about your own experience, be that through your own personal experience or indeed your professional experience of working with bereaved families, SANS is here for you, for anyone affected by the death of a baby. So important to say that straight up, and particularly as it's the first day of Baby Loss Awareness Week, as we know, the 9th to 15th of October every year. So thanks for the introduction. I'm going to share my slides here, which hopefully you'll be able to see on your screen just about now. That green screen, is that okay, Hannah? Is that working all right? There we go. Excellent. So I want to talk to you a little bit about the importance of high quality bereavement care, which includes the project that you mentioned, the NBCP, the National Bereavement Care Pathway for Pregnancy and Baby Loss. And then Lisa will pick up on some of those strands a little bit later as she talks about SANS training and education offer and unpacks a little bit more about some of the aspects of bereavement care that I'm going to be highlighting in this short presentation this evening. So for many of you, you may well be familiar with SANS. We've been going for sort of 45 or more years now. And for many years, we're known, as you said earlier, the Stillbirth and Neonatal Death Society, the acronym, but we're actually just SANS now. So we are SANS, and we have two core aims at the heart of all we do. Firstly, as you'd expect for a baby loss charity, we want to see the number of babies who are dying to reduce significantly across all four nations of the UK. And I don't have time to go into all of that now. We have seen reductions over the last few years, but not at the rate that we and governments across the UK had hoped for during that time. And so we are redoubling our efforts to support governments in their aims and objectives around that. But essentially, we do a lot of lobbying around the Saving Babies' Lives agenda, which many of you be familiar with, of course. That's about learning from deaths and putting those into practice. And then secondly, and this is the area that Lisa and I are more closely involved in, is about anyone affected by the death of a baby receiving the highest possible care, quality care, and the best support that they need. And so when we say anyone affected by the death, as I said earlier, this isn't just about families who've been affected by a baby dying or a pregnancy being lost, but it is for healthcare professionals too, and for students. So those of you watching, just to reiterate what I said, that SANS is here for you. And if you'd like to get in touch at any point, be that today or in the weeks, months and years ahead, SANS will be here for you. If you've had a difficult shift and you want to talk to somebody, please do pick up the phone, as well as, of course, signposting families who may well need some of our services. And I'll talk a little bit more about those later on. So that's what we are here to do, to ensure that the family receive the best possible care, really working with you as healthcare professionals. That's what we term as bereavement care. And then bereavement support is more the things maybe that SANS and others do in the community to support families, be that through peer support groups, some of the SANS United football teams, some of the things that we provide, the resources and support packs and so on. But so that you don't have to listen to me for 15 or 20 minutes, I thought it might be helpful if we show a video, which is called We Are SANS. It's only about 80 seconds long. So I'm hoping that our team in the background will be able to load that up and you'll be able to find it. SANS does have a YouTube site where we've got lots of different videos that you're able to access, and this is one of them. Thank you.
We are SANS. We support bereaved families and save babies' lives. We are the parents and families who remember every baby. We are the volunteers and befrienders here for anyone who needs support. We are the footballers who carry our babies' names over our hearts. We are the managers and colleagues who ask how you are. We are the campaigners who amplify bereaved parents' voices. The researchers who look for answers. The healthcare workers who strive to improve care. We are everyone who donates to and raises funds for this vital work. Together, we support families. Together, we save lives. Together, we will make a difference. And together, we are SANS. Do something amazing. Support families and save babies' lives.
Thank you. Appreciate you sharing that. That's really good of you. Thank you. And I could hear the sound, so I hope that worked for everybody. So as I say, you can go back and take a look at that on our YouTube channel, as well as a number of other videos that we have there for you. And as it said there, you know, SANS is a community. Yes, we have the supporters out in the community across all 4 nations of the UK. We have about 100 different groups that meet together. We have an online helpline and Facebook, closed Facebook forums, for example. We have a helpline that people can phone. We are SANS in terms of the staff, like Lisa and I and the others that we met on our team away day yesterday in London, and various others doing different aspects of work up and down the 4 nations of the UK. And we are SANS as well, healthcare professionals who are part of that community, striving, as I said earlier, not only to reduce the number of babies' lives, that the number of baby deaths rather, but also to support and care for the families who need high quality care at a moment of real personal tragedy and loss. And these points here just illustrate that, really, that good quality bereavement care, of course, cannot remove the grief that many parents and families feel, but it can make that devastating experience more manageable. And of course, the reverse is true, that poor quality care, things that are done maybe with best intention, but with the wrong words, or, you know, in a less empathetic way than is helpful, or processes that aren't followed, information that's not shared, you know, these sorts of things on that bereavement care journey, particularly those first few days, can really compound and exacerbate the pain that is felt by bereaved families. And we'll unpack a bit more of that in the rest of my talk and Lisa's a little bit later too. And we're also aware too that if we get a lot of reports of poor bereavement care in a particular hospital, trust or board, that can actually be an indicator of poor maternity safety as well. And so the two are intrinsically linked. And very much part of the bereavement care pathways I'm coming on to talk about is the whole area around the perinatal mortality review tool, for example, and the reviews process. So learning from deaths, giving parents the opportunity to share their experiences and to give their feedback on the quality of care that they've received. And if there is poor care, as I say, that can often be an indicator of poor maternity safety. So these are the 5 pathways that Hannah mentioned earlier, and just for the avoidance of doubt as well, there are 5 pathways that are part of the National Bereavement Care Pathway. This has been running since 2017 now in England, because there was a small grant that enabled us to do that from the Department of Health. The Scottish Government have then enabled that to happen in Scotland since the pilot phases 2019 onwards. And then more recently as well, we've had an announcement that Wales are going to be adopting, at least for 1 year, hopefully longer, a project akin to the NBCP, which will be about developing bereavement care pathways in Wales around these losses. And in Northern Ireland, the Public Health Agency there have committed funds to support us to develop the NBCP Northern Ireland project. And you'll see more about that sort of this time next week at the end of Baby Loss Awareness Week. So a little note for you there. So these are the 5 types of loss that are covered: miscarriage, ectopic and molar pregnancy, those earlier losses; termination of pregnancy due to fetal anomaly or TOPFA; stillbirth, neonatal death, and the SUDI death, the sudden unexpected death in infancy. That screenshot is of England, which is up to 12 months, but in different nations of the UK. Sometimes that's 12, sometimes that's 24 months. But those are the 5 areas of loss that are covered through the bereavement care pathway. And the vision, as it says up there, is that all bereaved parents are offered equal and high quality, individualized, safe and sensitive care whenever that occurs, whether that is at the weekend or overnight, wherever it occurs, whether that's at home or in an ambulance or in A&E or in maternity or in an early pregnancy unit or wherever it might be, and wherever that is in the UK, in all 4 nations. That is our vision, to have that. And as you rightly said, Hannah, this is now live in all trusts in England and all boards in Scotland, and soon in Northern Ireland and Wales. But trusts in England have voluntarily picked up the MBCP, but that doesn't mean necessarily that every healthcare professional and every team gets it right each time and every time. And so there's still lots to learn and lots to be done, because we often hear that practice is really good in one area of a hospital trust, but maybe is less good in another area. And what we're seeking is this equitable care. Now, SANS is leading this, but we do this in partnership with many others, some of whom have their logo on those pathway documents there, including a number of charities, royal colleges, and so on. And again, on our websites, both the SANS website and the MBCP websites, you'll be able to take a look at that. So what does bereavement care look like? What does that look like? What does that mean? And I don't have time to go into all of this now, but you'll be more than welcome to join one of our webinars that Lisa will mention a bit later on, where we unpack a lot more about what that bereavement care journey is and what those 9 standards are. Excuse me. But if I can quickly just group these into 3 lots of 3, sort of starting from the top and moving around in a clockwise direction. Those first 3 are very much based around the bereaved family themselves. So we believe it's really important that parents are given the informed choices that they are then able to take as part of their loss. So being able to make informed decisions about things like post-mortem consent, for example, or about maybe taking baby home with them, or the funeral arrangements, about lactation or donation, for example, giving bereaved families all the information for the various aspects of this bereavement care journey, so they can make that informed choice. And often we have to give that information, don't we, more than once, because of the fog of grief and the trauma that is affecting their well-being at that time, of course, and making sure these things are written down as well as said verbally and in an empathetic way. And that also is about signposting on to other services out with the hospital setting. Secondly, that there should be the opportunity to make memories, the opportunity to maybe do hand and footprints, or to have photos taken, for example. And again, in another day with more time, we'd share some of the slides there of parents sharing their quotes, one of which, memorably, one bereaved mother said, at the time I was asked about photos and I thought, why would I want a photo? This has just been a nightmare. But actually, I'm so glad I was asked. I'm so glad I've got a photo of my little boy. I just wish that I had more photos of his tiny hands and his tiny feet. So these can be really precious memories. SANS provide memory boxes, for example, that have little teddy bears in, memory books, and lots of things, tangible things that can help families to make memories. And in a training session, Lisa can provide another time. They go into a lot more detail about, you know, what is the theory behind that around making memories, and why is that helpful in such a difficult time. And then linked to that is having a bereavement room or a bereavement suite. Many of you will be familiar, of course, with what that looks like in a maternity setting. Most hospitals now across the 4 nations of the UK have a bereavement room or a bereavement suite, certainly in maternity services and sometimes in others. And we think that wherever that news is broken, or wherever the families need to gather and to spend that time with their baby to make those memories, it should be in an appropriate room that is soundproofed, away from the sound of healthy crying babies and happy families coming in to see their families within the hospital setting. So bereavement rooms, so important. The next 3 then are more around healthcare professionals. You know, this is so important too. There should be someone who takes a lead for bereavement in each hospital trust. We're very familiar with bereavement midwives, I'm sure, across the UK, but Actually, it's having someone who is responsible for commissioning training, ensuring standards aren't just there for bereavement care within maternity, as a bereavement midwife might do, but actually across gynae, across A&E, across the neonatal unit, so that regardless of the entry point, I suppose, into the hospital, the same standard of care is being provided. And in SANS, we often talk about there being no hierarchy of grief. If a baby dies at 10 weeks old, or 10 weeks gestation rather, or at 40 weeks, it's still that family's baby, their hopes and dreams, and therefore that care that is provided should be of the same quality, the same standard, even if aspects of memory making, for example, aspects of the review process may not be quite the same in those two examples. There are incredible things that can still be done and to support that family in an empathetic way. There should be bereavement care training in much more detail. Bereavement care training specific to baby loss. There's a real uniqueness of loss when it comes to babies, of course. And again, training, SANS training will take you through that in much more depth. And often trusts and boards have bereavement services, don't they, with a bereavement team who are able to work with any family after the death of anyone. But actually, there's something very unique and very specific about baby loss that we feel is just so important that people are trained, that healthcare professionals are trained in providing high quality bereavement care. And that it's not just down to that individual either. It's not just the bereavement midwife or the bereavement link nurse in the neonatal team, but actually someone overseeing all of that who can make those changes and lobby for those changes in other departments too. So bereavement care is training, and as we go through the course of the evening, we'll put in the chat box, and at the end as well, when we share things, we'll be able to put those links in too that will show where you can access some of this training. There's an e-learning module, for example, about the MBCP that only takes 10 minutes to complete, and I'll pop that link in the chat afterwards too. And then there should be support and resources for healthcare staff. We are acutely aware of the impact that working with bereaved families has on healthcare professionals. You know, there's no doubting that. And again, in another agenda, we can talk about vicarious trauma, and we can talk about the impacts that breaking bad news has on healthcare professionals, that supporting a family through those early hours and days of their loss can have. So really important. SANS is a real advocate for you as healthcare professionals. We want you to have the best support that you can, both from within your trust or board and from other organisations outside of that. But also that you should have the resources that you need. You should have the memory boxes. You should have the memory making facilities, the bereavement suites, the right access to training, and the right access to the tools and the tangible things that are going to help you to provide that best care. Cold cots is another example of that. And then finally, the last three around sort of processes. So having a plan that's in place that is co-produced by healthcare professionals and families to help support them both inside and outside of the hospital setting. That there's a system that signals that there's been a bereavement, and this is often one that bereaved parents find so galling, is, you know, they'll get a letter from their GP a couple of weeks later, or a phone call or a knock on the door from a health visitor saying, how are you and how's your baby? Somehow that message hasn't got through, that information hasn't been shared, or there's two systems that don't talk to each other, or a process that's broken, and that can just add more and more traumatic experience to that family at a time when they need it least. And then evidently that bereaved parents, partners as well, should have their emotional and mental health needs assessed before they leave that setting, and be referred on to the relevant support that they need. Not everybody needs or wants counselling, for example, but those needs should be assessed primarily, and then the relevant referrals should be made. So the pathway takes you up to that point. It doesn't go into necessarily the counselling or other psychological interventions that can be put in place, but the assessment and the referral must be made. So really, that's it from me around the bereavement care pathway, and give Lisa opportunity to share her information, the things she wants to get over. But just to say that we provide lots of support, as I've mentioned. Our support channels are there, our online support groups, our local support groups. As I said, almost 100 of those, the football teams that you saw in that video earlier, the various resources, the events that we put on, and so on, as we work together, not only to improve bereavement care, but to improve maternity safety to reduce the numbers of baby deaths. So thank you so much for listening to me. I hope that's been informative and helpful to you. If you do have any questions, please pop them in the chat and we'll pick those up after Lisa's talk. There's some email addresses there. If you email bereavementcare@sounds.org.uk, that will come through to my team. So wherever you are in the country, we'll get a response to you. And there are 3 websites there, and hopefully we'll be developing the Wales and Northern Ireland ones too. So thanks again. And as I said, do take care of yourselves. And if you want to speak to Sounds at any point, we're here for you. Thanks, Hannah.